I think a lot of people have a lot of stereotypes and generalizations about the gender binary. For a lot of trans people, it makes them question their interests, their expression. I second guessed myself a lot growing up because there were a lot of things I liked that were stereotypically boyish that I was very much into and still am into. I think there's a room for everyone to like what they like, express themselves however they want. I think if people can understand and get over their biases and their assumptions about how gender stereotypes work, I think it allows not just trans people but cis people as well to put aside their fears or their generalizations and express themselves in a more truthful manner.
If a trans person does not conform to the gender they are transitioning to and has a few aspects that are traditionally to do with their birth gender, it is viewed that they don't know what they're doing or that they're not actually trans enough. Trans women especially are actually really held to very unrealistic expectations of femininity that you would never really hold anyone else to. I prefer to wear jeans, t-shirt and a jacket usually, and that in no way means that I'm less trans or less of a woman. Everybody has a different self-expression, and it is really a very bad and inaccurate way of judging somebody's gender identity. The best way is just to ask them.
When I started going up to the gender clinic in Glasgow, I just went up dressed as I normally would, which was just sort of jeans and ripped t-shirt. And I didn't feel like I was actually being sort of taken seriously. In the second appointment, I was wearing more sort of stereotypically manly clothes, and I feel like I was being taken much better.
There are a large amount of people that need to access these services that actually do not identify as male or female, and identify either as a mix of both or in between or outside of that, or any combination of the spectrum of gender as opposed to being in the binary. And a lot of the time they are forced to pretend to be something they're not, or told that they should be something they're not, and that what they are is not valid enough. A lot of them do feel dysphoria the same as other people, but their gender presentation is just not to the strict standards that doctors have historically required from people. So as a result, they have been denied treatment that they need just as much as everybody else.
I think a lot of people still have this generalization in their head that there's male and female and there's nothing else, whereas in reality we've kind of figured out that gender is more of a spectrum, that there's male and female and then there's a lot in between encompassing non-binary and various other identities. The medical profession is a bit behind on this, and I think they need to get a bit more aware of issues regarding trans and non-binary people. There's a lot of difference between how people express themselves and how people identify themselves, and figure out ways to best serve the patient's needs rather than trying to fit people into various boxes.
So I was at a GIC appointment, and the doctor had asked me if I was interested in being referred for bottom surgery, and I said it wasn't really something I was interested in at that point, and she said, oh, that's fine because gender's a spectrum anyway, and if you're non-binary you probably don't want bottom surgery. And I thought that was quite a strange assumption to make, that just because I'd said I didn't want bottom surgery that I would be non-binary, because I'd always said that I was like a binary trans man. It was great that she kind of recognised that gender was a spectrum and that not everyone attending the clinic would be a binary trans person, but to assume that a binary trans person wouldn't want bottom surgery, or someone not wanting bottom surgery would be non-binary, I thought was kind of a bit of a jump to make.
Another thing that people have very much experienced is that when they're in the room with a healthcare professional, it feels like a power struggle, because the trans person's autonomy has been taken away in that situation, and their control over their entire life is in the hands of someone who will never truly understand. People need to pretend that they are something that they aren't. They need to perform to different standards of gender, different expectations of masculinity and femininity that cisgender people would not be held to in that kind of situation. There's also been a lot of experience of having to jump through hoops. It almost feels like you're having to do like an exam or a test to prove that you are trans enough, and to kind of have to live up to society's expectations as opposed to being true to yourself, which should be the whole point of this process.
It would be so refreshing not to be asked over and over again, why are you taking testosterone? Are you sure that skin condition is not because of, the hormone blocker? Gender-related medication does not have anything to do with my cold or my broken leg or, with anything to do but taking testosterone or taking hormone blockers.
I Okay, so I had a GP appointment once, and it was completely not trans related at all. And the GP was one I hadn't seen before, and she was very interested in me being trans, even though that wasn't what I'd agreed in for at all. Most of the appointment was her asking me questions like, "Oh, are you sure you haven't started taking hormones yet?" And I was like, "Yes." And then like trying to kind of make the subject back onto what I was there for. And then she'd be asking questions again like, "So you haven't taken anything, you haven't had any surgery?" And saying, "Wait, so do you want to be a man? Like, do you sleep with men or women?" I was just about to leave, and she kind of said, "Oh, one more thing. So do you still get periods?" And I was just like, "Yeah." And I just like ran out as fast as I could because I was just, this is so awkward. Like, I just wanted to like answer and leave, but I just thought it was kind of unprofessional.
I have been told before that I am not ready to go on hormones because of my mental health, and they thought that my depression was actually the reason why I was developing these gender issues. But in fact, it's completely the other way around. Because if somebody has crippling gender dysphoria and they feel this way every time they look in the mirror and every time they walk out of the house, of course that is going to then give anxiety and possibly depression and other things. And irrespective of whether a deed poll has happened, a trans person deserves to have their chosen name and their chosen pronouns respected. When I personally went to the GP and told them about my name change, they refused to update any documents without a deed poll, and even then they took a very long time to do so because they didn't see it as something that was that important. It is incredibly disrespectful to ignore this kind of thing.
So one thing I've found quite awkward is if I've had to go book an appointment for something that is typically what a cis woman might have, like a smear test or something, and I go to the desk and ask like to book in for that. The receptionist might ask me like, what would you want one of those for? You don't need that, you're a man, men don't need those. And then I have to go into a detail and explain, no, it's because I'm trans, I do need those, some men do need those, and kind of having to educate the receptionist, but also at the same time out myself to whoever can overhear, because they're usually in quite a public place and there's not much privacy. Like, people stand quite close behind you, the chairs are kind of everywhere, and then you've got to go and walk and sit down and kind of just be around all these people who've just overheard you have this quite personal conversation, which is really uncomfortable.
When I came out as trans, I'd already done a lot of prior research into how hormones and transition healthcare works. But when I spoke to my doctor about it, he was unaware of certain issues. Recently, I had a problem with changing my details in the NHS, and he was unaware of how that works and seemed to just think I'm stuck with an M on my NHS details. But I went and did some digging and found that there are ways to do it, and I had to inform my GP and my practice how to do those things, and they did them, but they were completely unaware of how these processes work. A lot of the time, trans people are constantly having to do their own research and find ways to get the healthcare that they need and inform their GPs, when in reality, I feel more GPs, more doctors need to be aware of these issues forefront and able to inform their patients.
Every time I go to the nurse to get my hormone blockers, I need to tell her why she's giving me the hormone blockers, that they're not testosterone, even how it works within my body, what that hormone blocker does. She's a medical professional. She should know how all of this works. It's not her fault. It is that medical professionals don't get access to this kind of information and don't get a specific sort of course or set of guidelines of what this medication does.
Pretty much ever since I started hormones, I've basically had to speak to my GP and just let her know exactly how I'm supposed to go through with my care. Even from sending off my referral to actually be seen by a gender clinic, I had to explain to her what needed to be written in the referral, who it was supposed to go to. And I mean, I was only 15 at the time. I was having to research how I should be taking care of my own health, when I kind of hoped to go to a professional and they would explain that to me. So like after again I started hormones, I was basically checking in with my doctor, making sure that they'd received my prescriptions, was checking up on when I was having letters come through from the gender clinic to them. So I was basically acting like a middleman the entire time. I kind of guess I was just hoping that surgeons and the gender clinics and my GP would all kind of speak to each other for me, rather than me have to intervene and be the middleman between all these services. And it was just a bit confusing, and not what I was hoping for out of the health service, to be honest.
It's incredibly important that general practitioners, especially in rural areas where they are less likely to meet a trans person in their everyday life, have enough training on at least the basics of transition, such as the hormones and also the psychological issues that may go alongside being trans. I was denied blockers on the NHS originally by my local rural funding board because it was deemed unorthodox use of it and that it was a frivolous way to spend NHS money. And it is very important that we educate people that this is not the case and that we absolutely are deserving of it just as much as anybody else that's suffering with a hormone imbalance.
Not enough doctors, nurses, GPs are being educated in just basic trans healthcare. I think it would benefit a lot of people if there was just more basic training for GPs. So like, this is how the hormone process works. This is how you might use a binder, and just all these basic little things that can help them along and just alleviate a lot of the pressure on gender identity clinics.
A reason why it's very important also for general practitioners to have at least a basic knowledge is so that when a young trans person who has just realised they're trans comes to their doctor asking for assistance, even if the doctor is not knowledgeable on this specific matter, they should at least be able to point them in the right direction to access resources online or clinics or other services that can help them deal with those specific needs.